Hi, it's Crystal with birthingandconsciouschoice.com. Today I'm thinking a little bit about the lost body of knowledge that was sacrificed in a large way because of the switch from the midwifery, mother-centered model of care to the largely male-dominated medical model of care. In particular, I'm thinking about how many things used to be able to be handled without a cesarean section before there were cesarean sections. I'm not saying that a cesarean is not an amazing life-saving surgery. It totally is. There are so many lives. There are so many babies that have been saved, mothers that have been saved with that wonderful intervention. I'm so glad that they've perfected it and that they continue to have it available. However, I think that it's sad that it is overused, especially in other regions of the world besides America. For instance, the cesarean rate in Brazil is nearly 100% in the larger cities and, where they have good access to modern medical care. 100%. Can you imagine the cultural expectations in a nation like that where there was just no other way? Of course you're going to have surgery. Of course you're going to schedule when your baby's birthday is. That's just what we do. We're really fortunate in America. Our cesarean rate is about 1/3, about 34%, a little higher than 1/3, which that's a lot better than some other countries, but I still question the necessity of that. The rate worldwide that is considered to be healthy or ideal is between 10 and 15%. So America is still a little on edge. In other words, the authorities believe that between 10 and 15% of pregnancies could benefit from the intervention of a cesarean section in terms of health and wellness for both mother and baby. So we've got a little ways to go. There's still, it sounds to me that there are still a lot of cesareans being done without full medical necessity. And to me, that's sad. I feel like a cesarean kind of, it takes something away from a woman that, it's, there's too much culture of, either it's like a competition or something, and it shouldn't be that way. Like, oh, well, my birth was more natural than yours, or, oh, well, I was able to schedule my cesarean, while yours was an emergency. Or why do we do this to ourselves? Why do we allow each other to treat us that way? It's ridiculous. Birth is not a competition, and any kind of birth can be beautiful, is beautiful. But even so, I think there are too many women out there who are being cut open unnecessarily. If you consider 200 years ago, before obstetrics was a major field, you have to think, I think it's always a good exercise to kind of think back to our roots a little bit. What did people do before there was a cesarean section? What did people do if there was, a breech baby, or, cord around the neck, or any other number of, malpresentation issues, or other things like, placenta issues that today, these are all, risk factors for determining the need for a cesarean. And while, okay, depending on the situation, it is safer and it can be safer, and that's awesome. I'm glad that we have that opportunity. But what did people do before? And I think that there is a body of knowledge that has been largely lost to antiquity, and that makes me a little sad. I think that instead of relying too heavily on technology, we should integrate our knowledge medically, holistically, culturally, so that our doctors and our healthcare professionals can be trained in surgical birth, but not only trained in surgical birth. It's always good to have backups, and it's always good to remember our roots. Just because we have this amazing life-saving technology doesn't mean that we need to rely on it and turn it into a crutch. When you think about national disasters, what are people going to do? If 80% of doctors don't know how to deliver a vaginal breech without a cesarean, where does that leave us if we have, a national disaster and no power or no electricity or no sterile conditions? What would we do? We need to preserve that knowledge, work on reintegrating it, and not because a cesarean is so bad, but because it's only one tool that should be in a toolbox of ways that healthcare professionals can help mamas and babies out. It shouldn't be the only thing that doctors are well trained in. So, deep thoughts for a rainy morning.